name's Nicara Newsom, and I'm in Communications 101, and I'm giving my information speech on the flu vaccine. Protecting yourself and your family is something that everyone would want. When it comes to locking your doors or keeping your kids close, most people would do anything to keep their family safe. So when it comes to the flu vaccine, wouldn't you want to do the same thing? Influenza, also called the flu, can be a life-threatening and require serious medical treatment. Today I'm going to discuss to you what is the flu, why it's so important to receive the flu vaccine, and evidence for the effectiveness of the vaccine, and dispel some myths that some people may believe about it. In order to understand the vaccine, it is good to understand information about the flu itself. Influenza, or known as the flu, is a respiratory infection that is caused by different viruses. It is very contagious and can be contracted through the nose and the mouth. The three types of viruses are virus A, B, and C. Type A is found in many animals and humans and is the most serious of the three. Type A can mutate into different kinds of the flu called subtypes. Type A and B virus has been known to cause worldwide pandemics. A pandemic occurs when a new influenza or flu comes out in which scientists have not discovered a vaccine for. One example of this was the 2009 H1N1. People who get the flu, type C is found in animals and humans, and it's not as serious, but usually only has symptoms that mimic the common cold. People who get the flu will usually recover in 1 to 2 weeks, but some people can develop serious life-threatening medical complications, such as pneumonia. According to the NIH Medline Plus magazine, the flu is a contagious respiratory illness caused by influenza viruses. It causes mild to severe illnesses and can sometimes lead to death. The best way to prevent the seasonal flu is by getting a flu shot each year. In the U.S., each year, on average, 5 to 20% of the population gets the flu. More than 200,000 people are hospitalized from flu-related complications, and about 36,000 people die from flu-related causes. The flu vaccine is widely used, but is it effective? According to the Centers for Disease and Control Prevention, a study by Bridges, as reported in JAMA 2000, among healthy adults found that the inactivated influenza was 86% effective against laboratory-confirmed influenza, but only 10% effective against all respiratory illnesses in the same population and year. There are times when the effectiveness can vary. For example, every year scientists invent a new vaccine, according to which flu virus is believed to be circulating that year. When the vaccine and the viruses are not well matched, the effectiveness of the vaccine is lower for that year. You need to get an annual flu shot or vaccine every year for it to be effective against each season's strain of flu. The flu vaccine works by causing antibodies to develop in your body. After about 2 weeks from receiving the vaccine, these antibodies will provide protection against infection with the viruses that are in the vaccine. The flu vaccine is for anyone wanting to prevent themselves from contracting the seasonal flu. However, there are those that are high risk. According to the Center of Disease Control and Prevention, those at high risk for complications include people 65 years and older, people with chronic medical conditions such as asthma, diabetes, or heart disease, pregnant women, and young children. There are many myths about the flu vaccine that prevent people from receiving it. One myth that I fell victim to in the past was that the flu and the stomach flu were the same thing. I worked for many years at a healthcare facility, and the residents that I cared for would receive the flu shot annually. It seemed like very soon after being vaccinated, many patients would have to be quarantined. This was due to vomiting and diarrhea, or as we would call it, the flu. I would always tell myself that obviously if the flu shot does not work if they were all becoming sick after receiving it. I found out that people, including myself, commonly confuse the stomach flu or gastroenteritis for the viral infection we call the flu. The flu vaccine is given to help prevent a viral infection that mimics the common cold, but can be more serious. Gastroenteritis is a bacterial infection that can infect your stomach or intestines. These are completely different. Another myth that you can get the flu Another myth is that you can get the flu from the flu vaccine, or that the vaccine does not work. There are symptoms from receiving the flu vaccine that could make you believe that you have the flu. These can include soreness, redness where the shot was given, a low-grade fever, aches. If you get the nasal spray, you can have a runny nose, a low-grade fever, and aches. All of these symptoms are mild and are not the actual flu. There are two types of the flu vaccine. The flu shot, which looks a little bit like this, which contains the killed virus of the flu. It is approved for use of people 6 months age or older in healthy people without chronic medical conditions. It cannot cause the flu, but may have some of the same side effects as I said previously. These symptoms usually only last 1 to 2 days. If you are afraid of shots and are healthy, you can receive the nasal spray vaccine. This vaccine is made with live, weakened flu viruses that cannot cause the flu. It is approved for use in healthy people 2 to 49 years of age who are not pregnant. Side effects can include, but are rare, a runny nose, headache, wheezing, vomiting, muscle aches, sore throat, and the cough. As with the shot, these symptoms may only last a couple days and far outweigh the risk of contracting the actual flu virus. If you are looking to get a flu vaccine, your doctor or pediatrician is the best place to start. Although it is rare, there is a chance that they could run out. Last year's H1N1 was a new strain of the flu, and scientists worked very fast at inventing a vaccine for it. So as a result, the vaccine came up short, and many medical offices did not have enough. If your doctor's office does run out, you can check with your local health department, and they can assist you on where to receive one. Most pharmacies also may carry the vaccine for a small fee. The flu season is usually from September to April. This year's seasonal vaccine will contain the H1N1 virus also. It is very important to receive the vaccine, not only to protect you, but also to protect the people around you. However, if you have egg allergies or are sick with fever at the time the vaccine is being given, you should not get the vaccine. As with many medical treatments, the flu vaccine is not without its limitations. The vaccine is not 100% effective, and some people can still get the flu after they have received the vaccine. For example, older people and people with certain chronic illnesses might not have the immunity that young, healthy adults do, and may get the flu after the vaccination. However, even for these high-risk individuals, the seasonal flu vaccine can still provide protection against getting severe complications from the seasonal flu. It is very important to become knowledgeable on the flu and the importance of receiving the flu vaccine. The vaccine is effective in most cases and does not cause the flu as myths would have you believe. Even with its limitations and side effects, the flu vaccine is very important to protect you and your family and those around you from getting the serious illness of influenza.